Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Good morning and welcome to Poison Prevention Week. I'm Jim Stallings along with Kay Murray. Good morning, Kay.
Good morning, Jim. How are you today?
I'm doing just fine. Of course, Health Talk brought to you by Mon General Hospital. With us in the studio this morning is Dr. Dave Lawrence with the Emergency Department at Mon General Hospital. Good morning, Dr. Lawrence.
Good morning, Jim.
Welcome to the program. Also today on the program, we have Beth Twigg. She's Trauma Coordinator at Mon General. Hi, Beth.
Good morning.
Welcome to the program. Let's talk about Poison Prevention Week. Obviously, this must be a week about education and reminding people what we do to keep our families safe, and also what to do should you suspect someone in your family has been poisoned. What's the most common type of poisoning within the household?
Current medications are the most frequent with household cleaners, and that sort of thing is a close second. In the medications, it's just actually changed from cold medications, which were previously the number one poisoner, to now pain medications, which includes the things like Tylenol, ibuprofen. But the real worrisome part is the amount of narcotics that are now in the household that can be deadly in even small amounts.
And you know, you think that's only for children, but in fact, we can talk about the teen, we can talk about the older adult as well. And you think, well, by now we should know better, but with medications, we can get confused and other things. So we're not just talking about children, we're talking about this prevention.
That's correct. Some of the tips on medications more are: one, never take anybody else's medications. They are specifically prescribed for an individual, and that's the only one that should take them. Two, lots of people are on multiple medications, and especially in the elderly, eyesight gets poor. You should never take things that you don't think of. Never take medications in the dark. Make sure that you're verifying what medication you're taking by looking at the label, and always keep your medications in the original container so that you know what you are getting.
If an overdose of medicine can be considered poisoning, can consuming alcohol in the home be considered poisoning?
Absolutely, especially when you take it along with medications. You can accidentally drink too much alcohol with medications that you should not be drinking with in the first place. So sometimes people just aren't aware that the combination of the two can be deadly.
See, I've already learned something now during Poison Prevention Week. When we think of poisons in the home, we do think of those cleaners underneath the sink and those types of things, but we don't usually think about the medications and also the alcohol in there that can poison people.
And you know, I think Whitney Houston's death told us a lot about that, Beth, with taking maybe Xanax or other type of medications and then immediately drinking and then getting into a hot tub of water, something that we were not aware of before that.
Absolutely.
Have you run into that at all, as far as having drugs with alcohol and the mixture?
We see it routinely, and the differentiation here is it is poisoning. Some of it is intentional, some of it is accidental, and some of it is actually a recreational misadventure, meaning that the intent was actually to use them, to get high, and not knowing 1 and 1 equals 3 when you start mixing things together, and things go bad in a hurry.
This is more of a curious question because I don't think the exact death of Whitney Houston has been ruled yet, but does a hot tub contribute that? If you immerse yourself in warm water after consuming these things, does that speed up the blood or do anything to your metabolism?
It'll do a couple things. There's something called hot tub syncope, which is you get into a hot tub and then you stand up to get out and you pass out. The reason for that is because when you get into the hot liquid, your body tries to get cool. So when it does it opens up all the blood vessels and everything gets shifted out of the middle of the body kind of to the skin as a cooling mechanism. So then when you stand up, there's no blood in the central system. It doesn't go to your brain and you pass out. So if you add alcohol plus a benzodiazepine, which is what Xanax is, or a anxiety agent or a sedative, as the classification would be in. The three of those would equal, would be more problemsome.
Do people get into a pattern of, and I'm going to use a for instance, going to sleep, I've got some pain, I can't fall asleep, so I'm going to take another pill to take care of the pain, and maybe drink a shot or something to help me go to sleep, or do something. I mean, mixing medications and really mixing poisons, is that common what people do? They think that one pill isn't working, I'm going to take another one and then perhaps more?
Certainly, yeah. That I would think that happens all the time. And it depends on what kind of numbers that you're talking when people get in trouble. So people get away with that for a while, and they don't know where the breaking point is, and that's when they get into trouble.
Okay, Dr. Lawrence and Beth, summertime, it looks like, is here. We didn't have winter, we didn't have spring. We're just going right into summer. Does that bring more poisons, more problems into the home with children, perhaps at home more often, and the insects are out? Do we see more problems during the summertime, Beth, than other times?
Yes. In the summertime, we have to worry about other kinds of poisoning, such as food poisoning. And as you mentioned, insects. We have spider bites or insect bites or even snake bites around here, different plants and mushrooms, things like that.
Do these stink bugs bite?
Not-
Have you heard of any bites from stink bugs?
Not yet, but boy,
See,
did I
still
have a
haven't-
lot of them last
I know.
year.
We just haven't found a cause for those things
I don't think
yet.
they're aggressive at all.
They're
I mean, their
not.
defense is their stink. So just don't crush them.
Just don't
Right.
I mean, they're not biting, they're stinging. That's not their defense.
Yeah, they don't bite at all. Okay.
No, they're a nuisance. To fly
Probably
around.
not a question for them, but I just had to ask.
They
it when
like
she was
your
talking about
gardens.
Yeah,
insects,
they like
so.
my walls for some reason. 304-296-0041 is Poison Prevention Week, and we're talking about it today here on Health Talk on WHAR.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Welcome back to Health Talk on WHAR. I'm Jim Stallings along with Kay Murray. And we have in the studio with us Beth Twigg. She's trauma coordinator at Mon General Hospital, and Dr. Dave Lawrence, who's with the emergency department. And I happen to know the jingle of the poison hotline. And you all should too, because you remember it. 1-800-222-1222. 1-800-222-1222. And that's a number that is something you should have around, because you never want to use it, but you never know when you're going to need to use it. So, one of those things, you don't know what's happening to somebody. You don't know if they've ingested something.
That's
Certainly
the
there are
difficult
signs.
thing.
Yeah. It's like all of a sudden your child's turning a different color, or just acting, vomiting, or some. I guess those are some of the signs, right?
Could be.
It could be.
Absolutely.
I mean, but how do you know? I mean, time is of the essence, right?
Right. Time is of the essence. If you even suspect that a child or an adult or anyone has ingested something or come into contact with some poisoning, should never wait for signs of the poisoning before you call that number.
And Jim, I think one of the important points here is that actually 70% of the calls that go into the poison control actually have home remedies that they can recommend, or tell the person that makes the call how to observe the person and find out if they're getting into trouble. So 70% of the people that of the phone calls fielded by poison control do not actually have to go to an emergency department, do not have to seek medical care. So it's a great resource. If you're in doubt and need to know what to do, it can save you that trip, time-wise, expense-wise, to an emergency department. And the people on the other end of the phone are very skilled. They are absolutely trained in toxicology, and that's who you need at the moment.
Do we do anything ourselves before we make that call? Is there anything we as adults, if it's a child, should immediately do?
Yes. First thing you need to do is make sure when you call that you have the container of the product that you think they may have been poisoned by. And they would like to have specific information when you call them. They need to know the person's age and weight, because treatment sometimes depends on what their size is. You need to know their health conditions or problems. You need to know what product it was. How did they come in contact with it? Did they ingest it? Did they inhale it? Did they get it on their skin? How long ago Were they in contact with it? What first aid have you already done? Did they vomit? What kind of symptoms they're having, and your exact location and how long it would take you to get to the nearest hospital.
Try to stay calm.
If they ingested a poison, is it still recommended to induce vomiting? Remember, that was the command that was on just about everything, is induce vomiting, but they never told you really how to do it.
No. You don't want to do that as the first line defense at this time. You call poison control and go by their recommendations. Do not use activated charcoal when you think someone may have been poisoned.
And I don't, to my knowledge, Ipecac, which was the great vomiting inducer, is no longer on the market.
Really?
I don't believe.
So there's been a change of thinking then.
Right.
Right?
180 degrees.
Because there's sometimes you don't want that out of your stomach?
That's correct. There's a couple that you can get in real trouble with, specifically gasoline, kerosene, the petrol kind of classification. They have they're real prone to being vapors. And if you induce vomiting and bring them back up, you bring the vapors back up, and the vapors are toxic to the lung. So if you get away with the ingestion, you may not get away with the vomiting and may end up with permanent lung damage.
And again, if our child is acting strange and perhaps we see an open pill bottle or something nearby and we fear the worst, we just call that number?
Yes.
And, I don't want to discourage people from calling that number. That's probably a great thing to do, but we're scared, we're worried, we can't think of the number. We can always remember 911.
That's correct. And if somebody appears to be that symptomatic, they are probably going to need treatment. So if you're unclear if they got into something, then call that number immediately. If the person that in question is actually appearing to be in distress, call 911 or head to the emergency department. If you have the forethought, bring the container that you think they got into, because we will actually use poison control at the emergency department and make sure that we use the correct treatment and antidote.
Now let's talk about a little bit more about bites from insects. And I wonder about those people who are allergic to bee stings. We know it's life or death with those people, but the first time they get stung by a bee, is that when they learn, or is there some kind of screening process that's done when you're a child to determine whether or not you're allergic to those bee stings?
It's usually, very rarely is it a first sting that you become allergic to. There's usually some progression. It's not impossible that you have your first exposure and get, the term is anaphylaxis, big long medical term for you swell up your throat, you get hives all over, your throat swells, and it can take your airway away. Most of the time it's a stepwise progression that it's not going to be on the first event. If there's a strong family history or there's been any little sign of it, you can always go to an allergist who can test for that. But again, it's usually specific to the bee wasp family most of the time, and most people get some reaction before they go to that terrible reaction.
Is there any more modern medicine or something that people keep in the house to treat bee stings, or is that just an emergency 911 situation?
No, people that are known allergic have the same thing that we use in the hospital, which would be epinephrine, and it comes in a self-injector, and people are trained if they are known to be that allergic. And it's a spring-loaded pen-type injector, and it will go through a pair of pants, it will go through a coat, and you just need to basically push it down against your leg or your arm, and it injects the appropriate amount of medication.
If we don't have the serious allergic reaction, but we get a bee sting, a wasp sting, or a spider bite, we get a little welt on it, and we can see the hole right there in the middle. It seems to me my mom used to put baking soda and water on it, or I don't know if that's an old wives' tale, but is there some way we should just treat that at home to get the sting out or the pain out or get the swelling down?
Benadryl or any antihistamine usually will help with that reaction. There's some non-sedating antihistamines that you may prefer over Benadryl. If you're really in discomfort from it, though, Benadryl offers that sedation, which actually makes it less bothersome. And then you can use a Benadryl cream, you can use hydrocortisone cream. Cool compresses or ice will take the sting out fairly well.
And Kay knows that I just get within 1 mile of poison ivy.
Oh, yes.
It's just whatever's in the air. I don't even have to touch it. It's like the oil comes off the leaves and it's suspended in the air, and it's attracted to me. And I think our pets can carry it in too. But I have a severe. Well, it's an allergic reaction. I don't know if it's severe. I've never had to go to the hospital. I've heard that people say, yeah, go get a steroid shot at the hospital after you get that poison ivy. It'll clear up in a day. I said, it sounds too good to be true. Then it probably is.
Well, steroid injections certainly help, but they're not the cure for poison ivy or sumac or poison oak. They may help lessen the inflammatory response that your body's having to the poison. It might lessen it some, but it's certainly not going to be the cure-all.
So you want to dry it out, I guess. You want to keep it from weeping. Is the weeping pus or fluid, is that poisonous?
No, actually, there's a lot of misconceptions on the poison plant issues. It's the resin on the plant that you're allergic to or gives you the rash. Once the rash is there, the only way it spreads is if the resin is still in the area. So when you scratch and it appears to get larger, it's because you still have resin either on your fingernails or on the skin and you're penetrating it. But the blisters themselves are just a clear fluid, and there's nothing in there that is of the poison.
So the resin is oil-like substance. I'm wondering if, scrubbing real well with Dawn once you've been outside and you think you've been mowing around poison ivy or something, that seems to cut grease. Is that something I should do?
There are a couple products out there. I don't know if I can give names.
Sure, you can.
Technu, Technu, actually makes a barrier product so that if you know you're going to be out and you might be exposed to it, it keeps the resin from adhering to your skin. And they also make a wash, and it specifically has a detergent in it, unlike the detergents that you can use like Dove soap, Dow, whatever, that is specific for the resin in those plants. So you wash with it, and then you just rinse off in a cool shower. And I've actually used it, and it does prevent the rash from occurring.
It's Poison Prevention Week, but today some education and tips you can use all year round. We'll be back in just a moment.
1-800-222-1222. 1-800-222-1222. If you think it might be poison, then the first thing you should do is call 1-800-222-1222.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Poison can be anything you're not supposed to take. Antifreeze, pesticide, the wrong drug by mistake. If you breathed a nasty chemical, been bitten by a snake, call the Poison Control Center hotline. We're here for you night or day.
Yeah, 1-800-222-1222. That's the number for the...
You do that so well. Talking about things we do at home, and I did as a younger person. Decided to clean my tub, and I couldn't get everything out, so I used one chemical, and then I dumped some bleach in. Never did it twice.
Never do that. Never mix household chemical cleaning products.
You almost get a gas that comes up, gases that come up and can get into your throat, and not a good thing to do. But we can make a lot of mistakes like that, Dr. Lawrence, in the home.
Absolutely.
With pesticides.
Antifreeze.
So what you probably did was ammonia and Clorox, which
awful.
Little chemistry set there, that's ammonia chloride. That will make you pucker up in your eyes water and make you choke. Some of the things that are around the house that are real deadly that I think we take for granted and just leave them lying around, that we need to be very cautious with. And the two that come to mind mostly are the windshield washer fluid, which they put in a antifreeze so that it can be used all year round. And that antifreeze in there is actually methanol, which can cause death, can cause blindness with very little amount needed to be ingested or drank.
And children could be attracted to that.
Correct.
Right.
It's a nice blue color most of the time. And the other one that is even actually more toxic is antifreeze. And I think we're probably a little bit more careful with it, but it is deadly. A mouthful will kill an adult.
All right. Well, thank you so much for the information this morning. It's Poison Prevention Week, 1-800-222-1222. Thanks to our guest, Dr. Dave Lawrence, and also Beth Twigg. Stay tuned for Morgan 10 a.m. coming up next hour on WHAR.